introduction of the MRFF. Welcome, everyone. My name is Agustina Gancia. I am the Senior Project Officer for Consumer Engagement and Capacity Building at Health Translation SA. You are joining in on our second webinar in our Spotlight series. And this month in June, we're focusing on the Medical Research Future Fund. Before starting, would like to acknowledge that we're on Kaurna land, and so we acknowledge the Kaurna people as the traditional custodians of the Adelaide region. We recognize that the Kaurna people's cultural, spiritual, physical, and emotional connection with their land. We honor and pay our respects to Kaurna elders, both past and present, and all generations of Kaurna people now and into the future. So we're sitting on Kaurna land, but I do acknowledge that other people might be sitting in other areas of lands. So what is a Spotlight series? At Health Translation SA, we decided to shed or shine the spotlight on different topics throughout the year. We've already had 2 Spotlight series. The first one was really showcasing everything around research impact. The second one was on implementation science. And essentially, it's a whole month where we share information, resources, useful links to different websites on the specific topic, and webinars as well. We have 1 webinar a week, and this month it's on the MRFF. And today we'll be learning about 2 researchers' experience on applying for a grant on the Medical Research Future Fund and how they successfully got their grant application and what they think might be next steps for increasing success for South Australia. Today's webinar, like I said, it will be talking to 2 researchers. So Professor Geraint Rogers, who's a Matthew Flinders Fellow and the Director of the Microbiome and Host Health Program at SAHMRI, and Associate Professor Odette Pearson, who's the co-theme leader at the Aboriginal Health Equity Research and Strategy Group at SAHMRI as well. Before I pass on the mic to Geraint, I'd like to introduce HTSA for those of you who may not know who we are. Our organization really aims to accelerate the translation of research findings into healthcare practice and policy, and also increase the whole of system research translation capacity to improve the health of all South Australians. So really, we really aim to accelerate the transition of research into policy and practice. How can we involve all of the stakeholders and make sure that the research findings are actually used? So we work with our partners. We've got 10 partners, as well as other stakeholders. And we're an independent catalyst and a broker to mobilize collaborations. So we do work around education and training. So what is research translation? How do we do it better? We do work around policy, so linking researchers and policymakers and clinicians. We engage consumers and the community in our work. We engage various other stakeholders as well. And we work with researchers and health services as well. And really, our bottom line is that research translation, it's a mindset. And the ultimate purpose is sustained impact, scaled and sustained impact. Really, what is the ultimate problem you're trying to address? And are you engaging with the next user and end user of your project? So that's it for the introduction of Health Translation SA. We are now talking to Professor Geraint Rogers. Like I introduced him earlier, he's a Matthew Flinders Fellow and the Director of the Microbiome and Host Health Program at SAHMRI. He's a molecular microbiologist and a microbial ecologist. His research program focuses on the contribution of human-associated microbiota to health and disease. So I will stop sharing my screen now and let him share his and tell us a bit more about how he successfully applied for MRFF grants. So over to you, Geraint. Thank you.
Okay, thank you very much. It's quite confronting to see a headshot of yourself from about 10 years ago. I'm afraid you're now going to be stuck with the slightly older version. I'll just find my talk. Oh. Okay, so before I, excuse me. Okay, can you see that slide okay, Agustina? Okay, great. Before I start, I'd just like to say that I'm presenting from Flinders Medical Centre down in the south of Adelaide, which is also on Ghana land, and I just want to recognise that land is unceded, and obviously I respect the peoples of this land. I'm not going to talk about a particular application that we've got up. I'll mention some that we've been successful with later in the talk. I really wanted to just talk a little bit about some reflections that I've had on the MRFF application process, how it differs from other funding schemes that I've been involved with, and how perhaps as a research community we can develop successful pipelines for getting more funding. I should say that I don't have any particular vantage point to give this insight. These are just my reflections. So obviously, historically, there's been a couple of major funders, Category 1 funders that we've relied on in research. So primarily the NHMRC and for some people to a lesser extent the ARC. And the model that their opportunities take is that you as a researcher define your study. So the funder has a blank canvas and you go to the funder and you describe what it is that interests you and why you are well placed to undertake that research successfully. And this work is born out of an understanding of the literature and the knowledge in the space in which you work. And your primary goal really is to obtain novel, useful insight from the research. And this feeds back in a closed loop into field-specific expertise. Now, when you make these applications, you also have to justify them as having a line of sight to impact. But importantly, you don't have to make the case that you're going to achieve that impact. You can be a basic research scientist proposing to do basic research. You just need to be able to make a case that ultimately this will have some practical benefit to the wider community. So these schemes are researcher defined. It's your idea, it's your project, and it's for you to make the case as to why it's important. They tend to have a relatively narrow focus, but with deep investigation. So these studies tend to have teams of people who have fairly well-aligned sets of expertise, and really the aim is to get some really detailed understanding of a particular phenomenon. They can be refined and resubmitted. Many NHMRC grants, for example, will get up after having been put in 3 or 4 even years on the trot, and you get an opportunity to refine them and make them better. And there's a defined application schedule. So I'm just trying to move my, defined application schedule. So we know when these calls are going to come, we know how long we'll have to apply, and we know when the likely outcomes will arrive. So in contrast, the MRFF has a very, very different model. The MRFF knows what impact it is that it wants to achieve. So these tend to be reactive calls. So the COVID-19 pandemic was a good example. We were faced with a series of health challenges. The MRFF identified a series of knowledge gaps and then called on the research community to provide solutions in getting us to address those knowledge gaps. So as a researcher, you come out of your field. You can obviously you rely on the background information in that field. You develop a study. You can develop insight, and that can feed back into field-specific knowledge. But it doesn't really matter. What matters is your ability to do a piece of work which gets to the impact which has been defined by the funder. Okay, so in contrast to the NHMRC, the ARC, where it's a blank slate and you create your own project, they already know what their idea is. They just want you to make a case that you can address it. So the contrast here is that this is funder defined. It tends to be much more broadly focused work, as I'll talk about a little bit more in a minute. And the investigations tend to be much tighter in their timeframes because this is reactive. Often they want outcomes within 12 months or 24 months. These applications are sort of single use. You won't get the same call, the same exact call coming more than once. I've put an asterisk there because they are recyclable. We know the broad areas in which MRFF calls will be announced. So there are pots of money relating to healthy aging, for example, or cancer research, or Indigenous health outcomes. So we know that there are going to be repeated calls in those areas, but the call itself will only come once typically. And it's an undefined application schedule. So we don't know when the calls are going to come out. We don't know how long they're going to give us to respond to them, and we don't know when we might hear about the outcomes. So these are two very, very different systems that are now living alongside each other in the sort of category 1 funding space. And it's really important that we as a community of researchers and associated people with associated roles understand how these schemes differ and ensure that the processes are not just copy and pasted across from the NHMRC or ARC, but they're actually defined and fit for purpose for this process. One of the challenges is that, as I said, the impact is defined for these calls. So most researchers or most people in research science sit somewhere along this pathway to impact. So they might be epidemiologists doing observational studies, they might be doing basic research, preclinical research, they might be trialists, they might be implementation scientists, they might be policy developers. And in the traditional model, you could sit here as a basic researcher and do basic research, and people would leave you alone as long as it was of high quality. But with the MRFF, where the goal is the impact, you not only have to make the case that your basic research idea addresses the question being posed, but you also have to make the case that the project that you're going to undertake will allow you to get all the way from wherever you sit on this pipeline to the impact that's required. And this really requires a fundamental realignment of how we organize ourselves as researchers. We tend to sit in field-specific sort of domains where we have a lot of colleagues who have similar skill sets and similar interests to us, and we don't tend to interact too much with people at different positions along this pathway. But obviously that has to be changed. And another thing that's concerning is that because this is a challenging thing to do, we face a danger that we're going to lose investigators to interstate applications. So, I mean, this happens with all funding schemes, but you may get a very confident, typically clinician from an eastern state who says, I've got a brilliant idea, this is what we're going to do. Come and sit on my investigator team, and you can be CIF and you'll get your name on the application, but I'll get the money and I'll define the pathway. And I think that is something we need to be aware of in South Australia. Obviously, we're a smaller state, smaller research community. Traditionally, we have punched above our weight in terms of MRFF outcomes, but we need to make sure that we are confident in our ability to write competitive applications and make sure that we retain research leadership here. One thing that is always asked by researchers, I think, in these kind of sessions is, when are they going to issue a call which relates to what it is that I'm interested in? And the answer is almost certainly never. And I think this is a challenge that we face, because what we can do is, and I'm trying to recognize that I'm talking to an Australian audience. I've got a picture of surfers there. I should say I know absolutely nothing about surfing whatsoever. But it did occur to me that there are two strategies in surfing as there are in funding applications. You can sit in the water, freezing your bum off, waiting to get bitten by a shark, hoping that the perfect wave is going to arrive. Or you can, as this person is at the top of the wave, you can paddle out and try and catch waves and make the best of each opportunity that comes along. And I think that's something that people have struggled to get their heads around a little bit. It's something that's really important. Even where a funding opportunity will, if you had a magic wand, you could say, I hope they issue a call on, whatever your area of particular expertise is. It's relatively unlikely that you are the leading expert in Australia. You may be in one opportunity, but you probably won't be the leading expert in more than one opportunity. So if there's a carve up of the funds available, I'm just using an example here of a sort of $6 million call. What we tend to see is that you'll get some large awards. So you'll get sort of maybe a $3 million grant and a $2.5 million grant, which will tend to align with the field leaders in those areas, the people who are really placed really well to tackle the problem head on. And then you'll also get some smaller awards, which tend to be complementary studies which take a slightly more novel or indirect approach to the problem. But altogether, these awards give a nice rounded program of research. And it's really important that you decide what your strategy is going to be. So if you take the view, as I'm suggesting, that you apply to as many opportunities as you can, when you're applying, are you well placed to go after a big sum of money and tackle a problem head on, or are you better developing a more oblique approach? And it's critical to both understand the landscape around the research community in relation to a particular call, and to understand your relative advantage or disadvantage in it. It's important to avoid duplication and to aim for complementarity. So when there's a decision made about which applications are funded, they're not going to fund the same study 3 times. And getting a sense of what other people are putting in and how your application aligns with that, I think, is really important. And scale according to the priorities of the call. So if the call is after something in particular, and you have decided, because of your understanding of the landscape of the research community, that you're going to write a grant that's a little bit off-center, complementary to other work that's going to be done, and quite novel, don't ask for 90% of the cash, because you're not going to be successful. And I just put this up to illustrate that point, which is that we've had some success as applicants to these schemes, and I'm not ashamed to say that I'm not expert in any of the areas for which we've received funding. And in each case, what I've had to do is to identify how my skill set and the skills that are available to me through my collaborative networks can be brought together to produce an application which is going to be competitive and potentially successful. And that's my goal. My goal here isn't to say, well, I've been working on a particular problem for 20 years. I want someone to give me some money so I can continue to do that, because I don't think that's ever going to be successful in this kind of context. I mean, the upside is that you get to do research on lots of interesting things you haven't necessarily researched previously, and that appeals to me. So I think it's important that we understand the nature of the MRFF call, how they're developed, how they're framed, and how outcomes are announced. So unlike the NHMRC, which has a blank slate in terms of most of its calls, these have been arrived at through a political process. People often lobby for particular MRFF calls. They know what they want, and the announcements of the outcomes tend to come at times which are politically strategic for the people announcing them. And when I've been successful previously, I've had to stand next to ministers for various things and have my picture taken. Obviously, the research we do should be designed based on research excellence, but we also need to be aware that this is a political funding scheme, and we need to take that into consideration when we design or frame the types of questions we're going to pose and the kind of ways in which we're going to do that. The practicalities of writing one of these applications, what I found is that it's impossible to design these by committee. What happens is you just end up with a kind of watered down idea. I think it's really important, given that so many people involved in the MRFF process, assessing applications and developing calls, are not field experts. Your application has to have a really clear narrative. It's got to have a really crisp idea that captures the imagination of the people who are looking at it. I think working as a committee tends to go against that. But that isn't to say that you shouldn't utilize all the expertise within the team. So what I tend to do is a process of workshop and conferral. So I will find a couple of people that I work well with, and I will try to come up with an idea, and I'll workshop that idea with them and advise it and workshop it. And then I'll take that to my wider CI team and get that kind of expertise that I don't have in all aspects of the application. And I'll go back and I'll workshop it again. And different approaches are going to work well for different people, but that's what works well for me. And I think it's really critical that we consider the local strengths at our disposal. I would try to utilize all and every advantage. So that includes researchers who are local, who have expertise, which would be helpful, but also platforms, registries, technological opportunities, working groups, patient representation groups, every possible advantage which I can bring to my application, I'll try to use. So just on the investigator team, I think it's important to build the team around the desired outcome. So when I was talking before about the sort of NHMRC opportunities, there you just need to show that you have preeminent field-specific expertise in whatever your chosen discipline is. Here, where you're trying to achieve a particular goal, it's essential that you build a team that addresses each component of that process. So I would suggest that people focus on skills, not on names or institutions. I don't think it's necessarily hugely advantageous to try and get the biggest name in the field onto your grant and think that's going to be sufficient to get you over the line if you've got gaps in the skills in the CI team, which mean that you're not going to get to the goal, which is what the funder requires. So I looked at some of the applications that I've put in previously, and there are field-specific specialists. So I'll obviously, if I'm doing an application on an infectious disease call, I'll make sure they're ID physicians or respiratory medicine physicians or neonatologists or geriatricians or psychiatrists or whatever it is that I need to address that problem. But then importantly, I also need non-field specific specialists. So these are people like epidemiologists, policy experts, data scientists, engineers, people whose expertise isn't necessarily limited to the question that I'm addressing, but is essential in me being able to address it successfully. You've also got to think about non-research community representatives, whether these be advocates, whether these be patient representatives, whether these are industry partners or community groups, people in the health sector, NGOs. It's really important that you can show that you have an ecology around your grant which will allow it to successfully achieve the goals that it's going after, but also that you're not developing this in a vacuum, that you are listening to the community, you are listening to people who understand these problems and are invested in them, and you're taking that into consideration when you're designing your application. The other thing that I wanted to mention was the importance of emerging research leaders. I said that these grants couldn't really be recycled, but I think it's important that we have, as researchers, a sort of institutional memory of the applications we've put in. And it's also important that we develop the clinician researchers and researchers who are coming through to be the future leaders. And this is certainly something that the MRFF suggests is important. So I would make sure that you do that, and I would also make sure that you point at it. And it should go without saying, but it perhaps can do with being said one more time, which is make sure that you're producing representative CI teams. I think, you don't have to go far to find a CI team for an NHMRC application, which is, 10 middle-aged white guys. And that doesn't represent the communities we serve or the research community or the clinical community. And I think it suggests that you're being lazy in how you put your research teams together and missing opportunities. And you know, it will be noticed, and it will not be helpful. And this is my final slide, because I wanted to just talk about how the HTSA, some of the gaps we have, and how the HTSA might be able to support them. So I mentioned earlier the importance of workshopping applications. This isn't something that research officers or other bodies have really supported previously, because with things like NHMRC, your applications are so specialized and so field specific that as researchers, you can just produce the application yourself. And when you get to the point of contacting a research office, it is to check that it doesn't break any of the rules and it's going to not be thrown out, and it's, you know, you filled in all the forms. Here, where you're producing grant applications, where you're not specialists in all aspects of it, where it's a very, very multidisciplinary team, bodies that can facilitate those workshops and those discussions and those interactions, I think, are very helpful and are probably correlated with funding success for the associated applications. The other thing that's important is when you're putting your team together, obviously you need to ensure you've got the skills you require. I think it's really important that the people on your team have the right personalities. You've got to work with these people, and everybody's got to recognize that while they've got a lot of expertise in their discipline, they don't necessarily have skills in other parts of the grant. And you know, that's quite a complex recipe to get right. And I think it's really important that what's focused on here is the overall team composition, not that you've got a PI that thinks they know everything and then just fills up a list of names. It really is a collaborative process. But where I think the HTSA might be able to help is in building networks. So if there's a funding opportunity and I realize that I need a healthcare economist, you know, a policy expert, an oncologist, so on and so forth, I'm reliant on knowing people who fit those categories locally, or being able to ask somebody that I work with whether they know somebody. And that's a very time-consuming process, and it doesn't necessarily give rise to the best people being in your teams. So how do we better understand the skills that are out there, the researchers that are out there, the non-research experts which are out there, and have those conversations early so that when the MRFF call comes out, we're already well placed to put the application together. If you've got a 2-week application, you know, trying to find a healthcare economist from a standing start is tough. Whereas if you can build those relationships in advance, you can, you know, devote more time to the preparation of the application. And next time there's a call, you can recycle those networks. And that's something which I've done in building my own networks recently. Importantly, these aren't networks that normally exist, because normally your networks involve people with the same interests and skills as you. These are networks which are multidisciplinary and cross-cutting. But I do think that the better we're able in South Australia to build these networks, the more success we'll have in the MRFF going forward. So that was everything from me. So I shall stop sharing my screen there. And over to you, Agustina.
Great. Thank you so much, Geraint, for that presentation. That was really interesting and really informative. It was great to see the comparison that you drew between, you know, the NHMRC, ARC grant calls for grants, and then compared to the MRFF one, and to see how what process you have done over your experience. So I just want to see if there's any questions in the room, if anyone wants to either raise their little hand or ask something in the chat. We have a couple minutes for questions before we hand over to Odette. Would anyone like to ask a question or even make a comment on the presentation? Ikushla, your hand is raised.
Thanks for that, Geraint. That was excellent. I've probably got a million questions, but the first one that popped into my mind was you mentioned that you've gone through a process of really trying to unpack your own skills and consider how you can apply those to other people's applications. I'm just wondering if you have any advice for people on the process you went through with that, because I imagine that could be an uncomfortable type of transition for some.
Yeah, I mean, I've known for years that my family aren't interested in my research. The realization has come later that, you know, nobody's interested in my research. You know, if you're interested in the microbiome, which is what I study, you're probably quite an odd fish. What people are interested in is health outcomes and how research can impact on problems which are challenging us as a society and as communities. So I think it's a question of being able to put your research to one side and pose the question, how can my skills contribute to a successful application which will ultimately be successful in improving outcomes? And in some cases, I've put together applications where I've been sort of CIJ, even though I've written it, because, you know, I have no business being at the front of it because that's not my skill set. In those instances, my skills are around sort of organizing people and drafting the narrative and so on. I don't know whether this is answering your question, but I suppose it's to try and be succinct. It's saying what is the idea that is going to be best able to address this knowledge gap or this question, and then how do we build a team that can address that question, and then where do I sit in it, as opposed to saying, I'm a microbiologist, I want to do microbiology, how can I bend the MRFF call to fit with my agenda? Because that process is always going to be imperfect and probably not successful. Is that, sorry, that was a bit of, I was wittering there. I don't know.
No, that's great, thanks.
And maybe just one more question before we head over to Odette. We have a question from the audience in the chat. Billy asks, how important are partners? What type of partners are best? And is it possible to get an MRFF without partners contributing cash and in kind? Yeah,
I think it depends on the call. Some calls, it is essential to have partners. Others, it isn't requested, but I think there's no circumstances in which having a partner isn't helpful. If you're trying to get an idea through to implementation and translation, showing that you're able to develop partnerships with industry or local health networks or pathology services or patient representation groups does talk to your ability to operate in that, you know, that sort of ecology of health translation. So I think it's always a good look. But the degree to which it's essential really depends on the call. I would always look to include partnerships wherever I can. The best kinds of partnerships, I suppose there's two ways to answer that. One is people will give you lots and lots of money without asking any questions. That's always the best sort. They tend to be quite difficult to identify. The most useful ones in terms of putting together a successful application, I think, are the ones who will contribute intellectually. So we put in an application with a series of residential aged care facilities, and we involving an engineering solution. And there was an engineer who was very expert, but had been, you know, living in a basement for years. No one ever talked to him except when the air conditioning went offline. And he was delighted to get involved and really contribute intellectually to the process of producing it. And that was superb, because it allowed us to understand how suitable the solution was from both sides of the fence, from the end users as well as from the researchers' perspective.
That's great. Thank you so much. I think we'll stop the Q&A for Geraint's presentation. And I'll just share this screen so that I can introduce Odette, and I'll be over to you. Odette is a Kuku-Yalanji Torres Strait Islander woman, jointly appointed as the co-theme leader within the Aboriginal Health Equity Research and Strategy Group at SAHMRI. With strong community and cross-sector engagement, her current research activities focus on how to reduce the disadvantage by improving health and social system responses to better meet the needs of Aboriginal people. So Odette, I'll stop sharing and over to you.
Thanks, Augustina. Okay, hi everybody. Thanks for inviting me to talk today at this webinar. I was a little bit surprised about being invited to talk. So the first thing I did was to just sort of try to reflect on my research sort of journey and the grants that I've been involved in, obviously, to date. And so that's really where this talk is sort of coming from, and it's more pitched at more like the ways in which I've sort of approached these things and been involved in either writing or contributing to grants. I'm also I'm here in the SAHMRI building on North Terrace, and I'm on the lands of the Kaurna people. So I'd like to also pay my respects to the Kaurna elders, past, present and future. I'm actually from North Queensland, so I'm a visitor to this land, and I recognise that the land of the Kaurna peoples and all traditional owners across Australia were never ceded. So the first exercise I did was just to think about the questions that Augustina had sent through. And one of them was, you know, what is the MRFF different to other schemes? And so part of this slide is just to show you that, you know, I'm actually like a probably early to mid-career researcher. So I'm coming into these schemes, I think really at a good time. So obviously, as Geraint set the scene, the NHMRC and ARC have been around for a long time, and more recently the MRFF. And for me, as you know, in my research career so far, the MRFF has been something that's really resonated with the work that I've been doing in Aboriginal health equity for many reasons, and I'll talk about some of that along the way. I think what started to appear to me was that with the MRFF, the grants, the teams are quite big teams, and that goes to the fact that they're sort of extremely multidisciplinary, as opposed to the sort of more traditional research, full-time research groups. So where I've got researchers there, I mean full-time researchers. A lot of the grants that I've been involved in that have been successful have a whole range of different, expertise on the groups, including a lot of clinician researchers, as well as industry partners. And the other thing that we've included in our grants are also community leaders and policy actors. So that would be one of the things that I would say is different to the traditional sort of MRFF grant. The scheme, and there's a bit of duplication, I think, between what Geraint's talked about and what I'll talk about, so I do apologise for that. The scheme is, this MRFF scheme is more prescriptive, so they really are very sort of clear, but not so clear as well, that you can be quite open as to what it is that they're expecting. And that is really highlighted in the guidelines, and the number of talks that I've been to as a PhD student, and then as a researcher, where they say, you know, make sure you look at the guidelines. I think for the MRFF, that is really, really important because it is a new scheme and there's always curveballs in there that you just wouldn't expect to sort of come up. You know, you're kind of going in and going, right, yep, I've written an NHMRC grant before and I know what's going on, and then all of a sudden it's actually not the way to address these grants, in that they're expecting something a bit different. I've already spoken about the multidisciplinary teams. So the grant themselves, the grant guidelines also do tend to specify that they expect collaboration. And obviously that speaks to the fact that they're very heavily focused on translation. They come with a range of schemes, so it's important to streams, sorry. So for one grant call, there may be several streams, and so it's important to understand the differences between those streams and whereabouts, you know, your idea or your sort of project might sit within those, to then understand, you know, which stream you'd be best positioned or best to go for. As already identified, they do focus on impact. So they actually require you to talk about how your grant will actually achieve impact. And they're also big on milestones. So actually looking across the life of the grant, what the timeline is and what milestones you will achieve. And then you are expected to report on those milestones annually over the life of the grant. We've probably all heard that, you know, there may have been people who've experienced unfortunate or devastating situations where we haven't applied by the rules and the eligibility of grants. One of the things with the MRFF is it's really important to understand, you know, what the rules are with regards to being an investigator on the grant. So within a stream, usually you need to check that you know, it may be that you can only be an investigator on one grant. And so one of the things that the MRFF has done is opened the CI teams up so much more than the NHMRC grants that, you know, many of the individuals that you might approach may also be approached by other research groups or other groups. And not everybody on the grants are full-time researchers. So it's really important to clarify and work through with the whole team, the whole investigator team, as to whether or not they are on another grant, and also to work closely with the research office around that as well. Otherwise, the grants can actually be not accepted at all for review. So with the MRFF application or grants that I've been successful on, every single one of them have been building on an existing project. And so that may be at the point of either co-designing all the way through to sort of implementing and evaluating the project. And so the previous research that's occurred was around, say, exploring, understanding the landscape, understanding, you know, what a model of care, for example, might look like. And then the MRFF funded research is really about either, you know, putting the meat and bones on the model and then implementing the model and evaluating it, or it's actually taking the research findings and implementing those within, a pragmatic setting. And so that, I would say, is something that we really were very grateful for, because a lot of the research, that we've done with Aboriginal communities up until then hadn't really had that real translational and implementation focus. So for our communities and the research we do with them, it's actually a great scheme. Obviously, we've spoken about, the need to include end users and industry partners as investigators. We haven't had any issues with regards to including even community leaders. And so that may not have track records in research, but you can clearly show that, without having these leaders as investigators, that the project is not going to be able to be implemented in the way or to, as successfully as it would be with these leaders on the grant. So we've kind of tested the boundaries, I think, in the beginning, and it's worked out. It's working out really, really, really well. Obviously, start early. I think with building on existing projects, it's a little bit easier than coming up with a concept from the very beginning, but still, of course, it's about starting early. The sort of lead time between the call and the application, the due date, varies. And so we've had experience with 6 weeks to write a grant, which can be very limited time, particularly when you've got community engagement. It's always great to identify communities or identify the services that you're going to be working with, but of course you need to get approval and engagement, endorsement from those services and work with those services around the application. The earlier the start, the better in that regard. And also, obviously the research office comes into play. It's always good to be in a position to have a full sort of draft of your application on the date that the research office requires it, so that you can go back and make sort of recommended changes. So then I thought about, okay, so we get told, we hear, do this, do that, start early. And then I thought, okay, well, what really happens? So, okay, read the grant guidelines. So my process is what I've been doing, and it has been changing over time. And then, my learnings are up there as well. So I just go start writing, and then it's like, oh yeah, I better read the guidelines. Okay, and then that substantially changes actually the flow of the grant. And what it is that is actually important. And in these sorts of things, we know that that less is more. And so it does take kind of a process to get it to the actual, to be able to meet the guidelines. Obviously, just simple things like, templates, margins. When we're working with teams of people and on the grant, so it's not so much, Odette's going to write a grant about her research idea, but we may have people writing sections or aims of the grants based on their expertise. And so when you're putting that into the templates, it can be a nightmare. So just be careful of all of that. Start writing as early as possible. That's not really what I do. And so that results in early mornings, late nights, long days, no weekends. I tend to use headings to guide the flow of how I'm writing, and then they can either stay in or come out. But I found with the MRFF that that's really useful because they are quite prescriptive in what they want. And so really just writing, you know, to that specific heading, then you're ensured that you're covering off on what it is they're looking for. And I'll actually sometimes leave the headings in as well. And that's come from sitting on review panels where, you know, the panel members are looking for those things. And so if you've got them highlighted there, they can see, okay, this is how the team's addressing this objective or this area. Towards the end. So yeah, just with the budget. So something I've learned over time is we have budget justifications. And so as I'm working through the grant, I will try to now, even in the comments or some way, sort of highlight, you know, what might have a budget implication. And I'll also look at the grant because they do change the ways in which the budgets are formatted sometimes, you know, and so you've got to think through, is it financial year, is it calendar year? How are they wanting it to be formatted so that you can sort of start thinking or working towards that way of outlining your resources that are required, as opposed to getting to the end of writing the grant and then trying to work all of that out. Seeking support from the research office. So I work with the research office. I find them very helpful in identifying appropriate calls and also talking through the stream, you know, which stream would be best suited to the project. We also have grants that we recycle, and so we talk about, you know, what might we be able to recycle and for which streams. We talk about ideas that we're thinking about in relation to research that we haven't sort of progressed, and then approach people early. I think these grants, they are more conducive to, you know, having more than one person write the grant. So just being prepared sort of ahead of time and having that thinking happening is very useful. And we also, they're big pieces of work, as you would all know. So, you know, being able to have some support around you to help pull together supporting documentation and the budgets as well. So this was really just my last slide, and I think one of the points I wanted to make here was that when I was looking at the grants at the beginning, you know, there were only I think 2 that had a specific focus for Indigenous health or Indigenous Australians, as they've said in here. But the rest of them were just in relation to either like a condition or a systems approach or systems response. And so it's about and I think Geraint made the point really, really well. It's about thinking about what either skill set you bring or you know, what your sort of area of interest is and how you can be more flexible in actually being able to sort of write to that and to look at where that fits within the objectives, which is a very different approach, I think, to what the NH and MRC offers. So that's really, really all I have. Augustina?
Thanks so much, Odette. That was a really great presentation and really practical too. I really enjoyed. I agree with Rebecca, your learning slide about, you know, what have you learned through all of this process, what's worked for you. It was really interesting to understand what your process have been and your experience has been. There's one question from the chat box, so I can ask that one, and I think after that we won't have much time for other questions. But Billy asks, it's a question for both presenters. So what's the best way to structure the 3-page impact section at the start? And what exactly do you include? Is it a mix of background literature review and impact statements? So there's a bit of 3 questions in there. But if either of you wants to answer that.
I might just quickly say, and Grant, I'm sure you can elaborate, you can talk to it better, but with that, that was probably the biggest learning for me, was where the first 3 pages or the impact statement is most prescriptive in the guidelines. So they're very clear. The grants I've been involved in are very clear about, even in the first sentence, we want you to tell us what stream or what call you're applying for. So I think when I actually got that wrong and got it to the research office and was told, no, go back to the guidelines, that was a really big learning. And so now I actually go through and really highlight, what they are looking for, what impact or objectives they're wanting to achieve, and what impact they're wanting to achieve. And then I structure that 3-page impact according to those headings and try to cover off on them. Over to you, Grant.
No, I think you said it all. I suppose I would agree in that the first third page of the first page of that impact statement is absolutely critical, and I reverse engineer that from the call to make sure nobody can say it isn't exactly lining up with the call. I do think that the sort of 3-page, 5-page structure kind of lends itself to 2 different scoring systems. I always think that the first 3 pages is kind of a cumulative scoring system. So the more exciting, the more novel and jazzy that first 3 page, the higher your score. And then there's a sort of inflection point when you go into the 5 pages of the project design, which is, okay, we're excited by your idea. Let's see if you stuff it up with the project design. And that's kind of a subtractive scoring system. So you try to produce the second 5 pages in a way that you don't make any missteps, which would undermine the reviewer's confidence that you can do what it was that you said you could do in the first 3 pages. So I tend to write those 2 sections quite differently. But I think it needs to be exciting. You need to get the reviewers on the hook, and you need to have a really clear, compelling narrative. And I overtype my previous application when I write those. I think what we're learning is that there can be quite a formulaic way to do this, and that can save a lot of time and energy if you know what the components are. You can just change them to be specific to the particular call that you're writing to.
Thanks, Odette and Grant. And I know we have 1 minute left, but there's a really interesting question in the chat box. If either of you can answer this in the last minute. It's about consumer and community involvement in your project. So this person is asking whether you should list a consumer as a CI or as an AI, just because there's a query around the CI statement and the required 5 publications in SAHMRI. So how would you go about that? And that's also a topic that we discussed at HTSA with our consumer engagement action group. So I'd like to hear about what you guys think.
I mean, I think, Odette, this is probably something that talks to your research. Really,
yes.
Importantly. I would just make one very quick point, which is that for me, it's around not their track record, but their intellectual involvement. So, where we do research with, for example, Indigenous communities, if somebody has a major intellectual contribution to the way that the idea is developed and the way that the study is designed and how it's going to be executed, it doesn't matter whether they've never published a paper in their life. Mm-hmm. They are a chief investigator. right? If there's somebody who's providing or supporting a process that allows the study to happen, again, it doesn't matter how many publications they've got, they're in AI. And I think that the MRFF is very forgiving around not enforcing a kind of traditional track record model for CIs. And I mean, I'd be interested to hear what Odette says, but I think it would be a misstep to not include people as CIs if they're intellectual contributors, regardless of their formal academic profiles.
Yeah, totally agree. So we've worked with the research office on this, and it's about being sort of innovative in the way in which you complete that CI statement. So even though, you know, there might not be 5 publications, there's things that community leaders are involved in that are, you know, transformational or around policy, or and it's about being able to describe that in a way that shows that, you know, they're actually sort of translating, they're leading, the work that they're doing it is all of that. It's just that it's not published necessarily. The other thing is that we have relationships with community groups and individuals over quite a long period of time, and so on our projects we'll have like Aboriginal governance or advisory groups or committee, and so we are very acknowledging of the role of the individuals in the committee. So we actually do publish with individuals and committees that are community members as well. So I think over time that will start, you know, in your research, you will build that with consumers being authors on publications. But I agree, the MRFF isn't so much about that. It's more about, you know, the translation of the research.
Thank you both for those answers, and also thank you both for your presentations. That concludes today's session. Make sure to join us next week for our 3rd webinar in our series of on the MRFF. We'll be talking to a panel of reviewers. So they'll be telling us about what makes a good grant application, what makes a bad grant application, what are the do's and don'ts of applying to the MRFF. So we'll get some insider knowledge and experience from them. And so they have a wide range of experience. And then the following week is talking to a panel that includes members of research support offices. So thanks again for joining. We'll see you next week. Thanks.